Welcome, everyone. Welcome, everyone, and thank you for joining us for tonight's webinar, Advocacy 101. I'd like to run through a few housekeeping items with you before we begin tonight. All participants are muted. For technical assistance, you can reference the Help tab at any time. If you have any technical difficulties, your best option is to close all of your browsers and log back in the same way you did the first time. We are recording this webinar and will provide the recording online within the week. Throughout the presentation, you are encouraged to ask questions. Please type your questions in the question box in the navigation column at the right of your screen. I'm now happy to turn the program over to our moderator, Dr. Rajani, to begin tonight's webinar. Dr. Rajani, the floor is yours.
Hello, everyone, and welcome to our first advocacy webinar. I'm Dr. Rajani, as Deborah introduced me, current president of the MSTS. Today, I'm joined by two members of our advocacy task force, Dr. Nina Gutowski and Kelly Homlar. We'll be discussing some of the basics of advocacy and what MSTS is doing to be more involved in this space. Please use the chat for questions. I'll be monitoring throughout the webinar. I'll save some time at the end for asking questions. This will be recorded and available on our MSTS website in addition. I'll start by introducing two of our speakers. Dr. Gutowski is an orthopedic oncologist at Cooper University Healthcare in Camden, New Jersey. She completed her medical school at Rutgers, New Jersey Medical School, her residency at Thomas Jefferson University Hospital, and her tumor fellowship at Memorial Sloan Kettering. She has a master's in public health, focusing on health policy and management from Berkeley. She currently serves on the board of the Philadelphia Orthopedic Society. Dr. Kelly Homlar is at the Medical College of Georgia in Augusta, Georgia. She attended medical school at MCG, residency and fellowship at Vanderbilt University. She was program director at MCG for 6 years, and she's currently vice chair for orthopedic quality. She has been on the board of the Georgia Orthopedic Society since 2016, served as a president from 21 to 22, and is one of three AOS Board of Counselors representing the state of Georgia. She's also co-chair of the MSTS Advocacy Task Force. Thank you for joining us. Nina and Kelly, I'll hand it over to you.
Thanks, Dr. Rajani. So let's dive right in and begin by discussing the current state of the American healthcare system, because as we know, it's constantly changing.
That's right, Nina. Our healthcare system is dynamic and it's complicated. There's multiple stakeholders involved, providers, patients, payers, all with multiple layers within each of these groups, and all that contributes to the system's complexity. It sometimes feels like navigating the healthcare system is becoming so challenging that it's eroding the doctor-patient relationship, which really has to remain in the center of everything.
Now, studies show that the public still trusts doctors, despite how the system in which we exist often feels broken, confusing, or unfair to patients. I found it interesting, though, that nurses actually top the list above doctors in terms of our country's most and least trusted professions. Fortunately, we are still above lawyers and members of Congress, which means that there is potential to accrue public support for initiatives that we choose to advocate for.
Patients are worried about our healthcare system. As this recent Gallup poll demonstrates, only 44% of those polled rated the quality of U.S. healthcare as excellent or good, which is a 24-year low. The public's overall rating of healthcare coverage has also dropped from a high in the 2010s, with a pretty quick downtrend in the past few years. So data like this suggests that there's considerable worry on the public's part regarding our healthcare system.
That's right. Now, some of this is likely due to something called the higher level phenomenon, that in general, the American public has a deep distrust for institutions. For example, a recent Pew Research Center study found that only 20% of adults report that they trust the government to, quote, do what is right and just always or most of the time. And this is down significantly from the 73% of adults who in 1958 answered yes to that question.
Yeah, I agree. There's definitely a growing distrust in government, healthcare, science in general, you name it. But what's also interesting, there seems to be a disconnect between the public's view of the system as a whole and their individual perception of the quality of care that they personally receive. So despite that distrust in the healthcare system overall, 82% of patients report the quality of care that they receive at their regular doctor's office as excellent or good. But either way, the public seems concerned.
And the healthcare workforce is also alarmed. These data from the American Hospital Association demonstrate that much of our concern centers around health insurers and the burden they apply to the industry. 84% of doctors and nurses report delays in patient access to necessary care. And 80% report that insurers affect their ability to practice medicine. 94% of physicians feel such an administrative and financial pressure from insurers that it has become difficult to operate a solo practice. And over 50% of nurses report that their job satisfaction has decreased due to insurer-mandated tasks.
Yeah, I mean, the landscape really has migrated far from where, the physician and nurse were focusing their time and energy on making patients well. Instead, they're just, distracted by all the administrative tasks required by insurance companies, and it really inhibits their ability to perform their job.
So patients are worried about healthcare. We are worried about healthcare. How do we create change? Some would argue that this is where advocacy comes in. So what does the word advocacy really mean anyways?
I mean, the dictionary definition is just the act or process of supporting a cause or a proposal. I really like the Johns Hopkins School of Public Health definition, which defines advocacy as strategic actions taken to drive social, organizational, or policy change on behalf of particular health goals or population health. And it encompasses a range of disciplines and practices that effectively engage and inform policymakers, media, and the public to act and embrace evidence-based solutions for public health challenges. It's a mouthful, but I think it's a good definition. And, we've been thinking a lot about how advocacy can and should fit into the life of a busy orthopedic oncologist.
So I don't know about you, Kelly, but for many people, when they think advocacy, they think of lobbyists or lobbying. So what is the difference between advocacy and lobbying?
Advocacy on the very basic level is just having an opinion, voicing that opinion, and trying to sway others. Lobbying is really a subset of advocacy, and it refers to speaking with people who make laws and asking them to make a change with a specific piece of legislation.
Okay. You also hear people throwing around the term grassroots advocacy. What does that mean?
Yeah, that's just, really regular people mobilizing to create change by directly engaging in the democratic process. So ordinary people, not lobbyists, not top-down organizations, but ordinary people influencing public policy, legislation, or decision-making. So it's really a bottom-up phenomenon. It's a collective action. This is large groups of people speaking up to show policymakers that either there's widespread support or opposition to an issue. And it includes tactics like contacting legislators, writing letters and emails, social media awareness campaigns, things like that. And that's really a lot of what healthcare advocacy entails. And that's, all professions do this.
Yeah. And along those lines, you have all probably heard the adage, if you're not at the table, you're on the menu. We hear this a lot in conversation. Is that true in healthcare policy as well?
I mean, absolutely. Certainly true in healthcare policy. This is just my opinion, not really speaking on behalf of the MSTS. But, I think this is what has led to our current predicament. Doctors have always been extremely busy, focusing on taking the best possible care of our patients, advancing the science of medicine. But while we were focused on our patients, hospital organizations, insurance companies, policymakers were at the table making decisions about how healthcare should be delivered, decisions that may or may not have been in our or our patients' best interest. So we realize now more than ever that we have to be at the table discussing these issues. This is advocacy. It's our way to drive healthcare in the way that we know is best for patient care, and it's our way to defend against those who are trying to make our job harder. As orthopedic oncologists, we're already involved in several physician groups who are advocating on our behalf, whether or not you're aware. The AAOS is a large and important voice, has substantial lobbying efforts. And just to clarify, there are two different entities with the acronym AAOS. There's the American Academy of Orthopedic Surgeons, the red logo on the left. That's lovingly known as the Academy. It's the educational body, and it's what we commonly think of when we use the term. However, the advocacy arm of the organization is the American Association of Orthopedic Surgeons, and that's the blue logo, and that's where the Office of Government Relations is housed. And the OGR promotes and advocates the viewpoint of the orthopedic community and has a multifaceted approach to lobbying for our interest at various levels of government. Of course, these are orthopedic surgery viewpoints, not necessarily orthopedic oncology specific.
There are other societies that are also advocating for the interests of physicians in general, such as the AMA, with a very broad and general position to protect physicians, and your state orthopedic and medical societies. The narrower the organization gets, the more specific the advocacy aims will likely be. Now, within orthopedics, certain subspecialty societies advocate for its members particularly effectively, such as AAHKS, voicing the concerns and opinions of arthroplasty surgeons. And this is where the MSTS would really like to grow. advocacy has been defined as a key pillar in the most recent MSTS strategic plan, recognizing that there are specific issues that affect orthopedic oncologists that are worth advocating for.
So the MSTS established an advocacy task force. And one of the first questions to the task force was, what do we want or need to advocate for? What's important to us specifically as orthopedic oncologists?
And many of these issues are similar to the current advocacy priorities of the AAOS, but there are some things that we care more or less about than the Academy. Our patients are different. They have different experiences. They may have different needs than the average orthopedic surgery patient.
So we followed the lead of other organizations and came up with our top priorities and then tried to put them into tiers, because obviously we can't prioritize everything all at one time. And so tier 1 would be an active pursuit, and tier 2 would be something that's either an opportunistic action or something that we're actively tracking.
Our first tier 1 pursuit listed is to increase access for patients with musculoskeletal oncology conditions. Access encompasses many things: fighting against narrow networks, overcoming care delivery challenges in rural settings, addressing financial barriers to care, etc., all with the overarching goal of patient to the right doctor at the right time.
So the next is supporting efforts to reform prior authorization and coverage reviews. All of us have had times where prior authorization has caused unnecessary delays in patient care. There's been some success at the national level in regards to prior authorization reform from a regulatory standpoint, but there's still a lot more to do in terms of implementation and enforcement before we really see any improvement on the front lines. And so we would ask if any MSTS members have experiences where they've felt there was an unnecessary delay or patient harm, then please share those stories with us, because these personal stories are extremely impactful when talking with lawmakers.
We are also working to increase visibility of orthopedic oncologists as the primary surgical group for bone and soft tissue masses. Now, which departments treat which tumors is somewhat institution specific, but this pursuit really focuses on public relations and communication with both patients and other medical professionals to establish ourselves as the most qualified to treat extremity bone and soft tissue sarcoma.
And then increased integration of clinical practice guidelines and appropriate use criteria on musculoskeletal tumors. Of course, this is how can we continue to lead the field in advancing and providing evidence-based medicine for our patients.
The next is to increase funding for research in the field of musculoskeletal oncology. At the federal level, fighting against the threat of unprecedented cuts to cancer research funding, and at a more local level, supporting other avenues of funding, including grants like the ones provided by Sarcoma Strong, an advocacy group started by our very own Matt DiCaprio.
And then advocate for fair surgeon reimbursement to support network adequacy. So ensuring that coding and billing and reimbursement reflects the amount of work that's actually being performed, supporting reforms to CMS reimbursement. So, effectively hospitals and practices can stay financially viable. If hospitals and practices close, patients lose access to important services. So, and these are tier 2, so not any less important, but, for some, maybe the timing isn't quite right to actively pursue, or it's an issue that's always on our mind, to act when opportunities arise.
The first is to increase usage and involvement in the AAOS MSTR registry. All of us see the value in this registry and really want to see this grow and succeed, which will certainly happen, but there's still some things that need to be worked out before we can really prioritize this for all.
Another is supporting cancer care integration across multiple specialties. This includes collaboration with other subspecialty organizations, can include issues like EHR interoperability. Sarcoma care is certainly a team sport. It's always important to seek out ways to make integrating this care between all parts of the team more seamless and easier to navigate for patients.
Another pursuit is to support policies that enhance diversity, equity, and inclusion in the MSTS and in the care of our patients. Despite the political rhetoric around this wording, the task force believes the MSTS continues to value diverse perspectives within our society as a means of providing high-quality care to all musculoskeletal oncology patients.
And encourage surgeon-led value-based programs. While other specialties such as joint arthroplasty have been the main focus and are really leading the way in value-based programs, we all need to think about value in healthcare, things like containing cost, decreasing variability of cost across different locations or hospital settings. All of these are likely to become increasingly important, even to us as oncologists. So maybe not a tier 1 priority, but something we are actively tracking.
Okay, so maybe this has got people all fired up to get involved in advocacy. What are some ways somebody new can get involved?
Well, I think it depends on how involved this person wants to be. Some people want to get deeply involved, and some people really just want to support the cause from the periphery. I always recommend when deciding to get involved in advocacy to think about getting involved on both the state and the federal level. The state level is important because there's always going to be issues that arise in your state that will directly affect your practice. Different states are facing different issues at different times, and these issues tend to come and go. Things like tort reform, scope of practice issues, CON laws, and it's important to be aware of what's going on in your state. Sometimes issues can be tackled on the state level that are much more difficult to address than on the federal level. But of course, it's important to be involved on the federal level because that's where the big overarching decisions are made about the future of healthcare.
I see. That makes sense. And I have a lot of colleagues who say, they want to support the cause, but they just don't have time or energy in this phase of their career to take on one more organization or committee. What do you say to them?
Great question. I mean, not everyone has to be directly involved. We understand that people are stretched thin. Not everybody's going to have an interest in serving on another committee or meeting with lawmakers. And so if you can't be directly involved, then support those who are already working on your behalf. And a lot of times that means supporting from a financial standpoint. So join and support your state orthopedic society. Donate to your state PAC. Join and support the AAOS and donate to the Ortho PAC.
Donating to a political action committee. I feel like this sometimes comes with a negative connotation. People feel like politics is dirty or you have to bribe people to get things accomplished. What's your opinion there?
Yeah, I mean, I hear those same concerns voiced by colleagues, but I realized early on, however, that the system's kind of set. It's not likely going to change anytime soon. We can either complain about how things getting done in politics, or we can try to understand the system and work within it to accomplish what we need. I think having a better understanding of political action committees helps you understand how donating to a PAC is not dirty, it's not a bribe, it's really just the cost of doing business and what allows our voice to be heard.
Okay, I'm tracking. Tell us a little more about political action committees.
So, a PAC, or a political action committee, is an organization that collects funds from members and directs them towards political campaigns. And so in healthcare, a PAC is typically used to support candidates who are supportive of the overall house of medicine. For example, if a doctor's running for a political position, it's very likely that we would want to support their campaign. If a lawmaker, really tends to understand the challenges we face and are supportive of the issues that we find important, we may want to help keep them in office when they're up for re-election. The other benefit is that PAC money is typically distributed at an event or a meeting with the lawmaker, which allows an opportunity for open dialogue, helps establish personal connections, and forge relationships with those people who are able to enact change.
So Kelly, it's important to note that Ortho PAC and state PACs are nonpartisan, correct? They will donate to both sides because they are focused on policy, not just politics.
Yeah, absolutely. It's a good point. Very important. So, we focus on policy, not politics. We really need to focus on the issues that affect our patients and our professions and don't get into any, inflammatory politics.
So how do we in orthopedics compare to other groups in terms of giving to PACs?
So these are numbers from the AAOS Office of Government Relations from 2023, 2024. And you can see on the left that compared to other medical specialties, orthopedics does pretty well. You see anesthesia and dermatology and then us. But when we compare ourselves to other non-physician groups, it's a little eye-opening. So on the right, groups like the Trial Lawyers, the American Hospital Association, United Healthcare, they're very involved politically. So it just makes you wonder, whose story is being heard, who has a stronger voice.
And do you think a PAC contribution amount directly reflects effectiveness in advocacy?
I mean, no, not completely. Yes, PAC money is a valuable tool in getting our voice heard, trying to secure us a seat at the table. But to me, it's not necessarily about PAC contributions directly. I see those contributions more as a thermometer of who's interested, who's invested in the process. One of the biggest issues we face in advocacy is apathy. People know the issues. They may complain about the state of U.S. healthcare. They either just do nothing, the so-called silenced majority, and ignore the issues, or assume that others will continue to fight on their behalf. In 2023, about 20% of AOS members donated to the Ortho PAC. In 2024, 6% of MSTS members donated to the Ortho PAC. And I don't think it's that MSTS members don't care. We're a caring bunch of physicians. I just don't think we've prioritized this in the past. And so we hope that this advocacy task force can sort of be a call to arms. Orthopedic oncologists are some of the brightest thought leaders in the field, high emotional IQs, true passion for improving care for our patient. And it's just really the type that you want to drive change.
Okay. So what about those colleagues who say, I do want to be directly involved? What are some ways to get involved? Let's start at the state level.
Yeah, I would say, first priority, join and support your state orthopedic society. Some state societies are more organized and involved than others, but all are monitoring what's going on at the state level and intervening when needed. So get to know the board, get to know the lobbyist, volunteer in a leadership position. In any of those interactions, you're going to start seeing what goes on behind the scenes in advocacy. Some may even have a health policy or advocacy fellowship. There's plenty of other opportunities to get involved at the state level, like hospital advocacy committees, county medical societies, state medical societies. But I feel like your state orthopedic society is a good place to start.
What about meeting with lawmakers?
Yeah, absolutely. Another way to get involved on the state level is figure out who your state representative and state senators are, get to know them, see if there's a fundraising event coming up, or you can reach out to their staff and request a meeting. Typically you'll bring a check. There are some rules to be aware of. Like in Georgia, you can't bring a check when they're in session, but their staff will know those things. But when you meet with them, just first establish rapport. Let them know who you are, what you do, and then you can briefly discuss issues that are affecting your patients or your practice. Give them your phone number. Ideally, get theirs if they're willing. The more people we have talking to lawmakers, the better. Once you get to know them, you can be a voice of reason and a resource for them in the future when issues come up.
And what would it look like to get involved on the national level?
Much of the state level discussion translates to the federal level. You need to get involved in organized medicine, through the academy, things like Board of Specialty Societies, Board of Counselors, joining grassroots events like the AOS Advocacy Week, or other, the advocacy arms of the Tumor Society or subspecialty societies. But look for advocacy opportunities. Similarly, find your U.S. representative and senator and try to initiate contact, attend one of their fundraisers.
So we've listed some helpful advocacy sites. The top website allows you to easily find your elected officials, both state and federal.
The next one is the AOS Advocacy Action Center, and that website was newly revamped. And it's pretty user-friendly. You can read about AOS advocacy issues, see which lawmakers co-sponsor bills that they're tracking. You can get involved and send pre-formatted letters on issues to lawmakers that you can personalize and then send. And then they even have a point system trying to tap into that competitive nature of orthopedic surgeons, where you get points for engaging in advocacy actions.
Now, because the AOS is not ortho-oncology specific, it is helpful to see what other organizations, like those who represent medical oncologists, radiation oncologists, et cetera, are advocating for. So this is the advocacy page for the American Society of Clinical Oncologists, and it is informative and very user-friendly.
And so the next thing you see that you can, AOS members can donate to the OrthoPAC at any time by texting that 41444. But now, if you haven't donated and you're interested, now is actually the perfect time. So through, I think, September 12th, they have the PAC match. And so if you donate to the PAC, they will donate money to an approved 501c3 organization. So a lot of people will give their PAC dues during this time, and then you can give money to something like OREF. And so you can do that through the text, the match 25 to 91999.
And what are some good ways to keep up with current issues?
There's plenty of information out there. Sometimes it's overwhelming and it's hard to hone in on what is the most useful information. But I'd say look out for the AOS Advocacy Now emails. They're bi-weekly and they'll have a lot of special communications. If you've been looking, there's been a lot of special communications about student loan repayments and research funding, physician reimbursement that have come across recently. But those are helpful. Your state societies typically offer updates while state legislators are in session. I know the Georgia Orthopedic Society, our lobbyist sends out a weekly email and essentially has all the bills that may be of interest to us, and it kind of tracks them through the process. And I like listening to podcasts. There's the AOS Advocacy Podcast, the AMA Update. I personally really like one called What the Health. There's one called Trade-Offs. And so, search around. There's lots of information out there. And so for those who have decided that they are interested in advocacy, this is kind of a checklist that you can go through as you advance on your advocacy journey. So you can check it off. Join the state society, donate it to OrthoPAC, donate it to state PAC, figured out who my state representative are, figured out who my U.S. representative are, met with one of the legislators, submit a story to us that can help us when we're talking with lawmakers. And then join organized medicine in some type of advocacy role, whether it be on a committee, a board of a state society, BOC, or BOS.
As we begin to wrap up, Kelly and I want to thank everyone on the MSTS Advocacy Task Force who we've worked closely with over the past year as the society has really begun to dig in on this initiative. Their names are listed here, and they've been foundational in getting this effort off the ground. Please feel free to reach out to any of the task force members with questions or suggestions in regards to MSTS advocacy. And we'd also like to thank the audience for logging on tonight.
Well, that was great, Dr. Gutowski and Dr. Homlar. That was a great overview of what MSTS is doing and what's important about advocacy. As you know, that's been my big focus over the last year. I'm going to ask a couple questions here. One is, where does the MSTS really want to go with this? I kind of know the answer already, but I'll let you guys answer.
Yeah, I mean, I think in the most basic form, obviously, we want to engage members to get involved. We want to actively track what's going on politically, be able to update and inform members and intervene when needed. And ideally, as we go forward, potentially drive change.
I also wanted to point out one thing during the talk is that this is a perfect time for people to donate to the PAC, the Ortho PAC. This is a match period until September 12th. And actually the MSTS is also a place that will get matched also too. So if you donate to the Ortho PAC, that's texting AAOS to, I believe it's 41444. Is that the number? And that should be able to the first start, or you can just go online and find it. But the MSTS is one of those. And the other thing I did want to ask before we go is, what would be, if you just had to pick the one thing that everyone's going to do right now and leave this talk and go do, what would it be?
That's a tough one. I mean, an easy thing you could do like tonight, if you don't know the name of your state and U.S. Representative and senator, just go look it up. At least start with a name. Then you can set up a meeting tomorrow.
And I would say it's really important to get involved in your state orthopedic society. So much of advocacy, especially early on, is just kind of grassroots, local issues, and then you build from the bottom up. So get involved and really familiarize yourself with the local advocacy efforts that are current with that society, and volunteer, get involved. The effort is really valuable on that level.
Yeah, and I have a couple questions from the audience here. That's perfect answers, guys. Does the MSTS have a plan to go to DC at some point?
Yeah, so I mean, a lot of the MSTS members are already there. This week is National Orthopedic Leadership Conference, or I guess next week, starting Sunday. And that's really, the executive line of the academy. You got all your state orthopedic societies. So the Board of Specialty Society member for MSTS goes. And then anybody who's part of the advisor circle. So we as MSTS are part of the advisor circle, and somebody can go through that. And so there are definitely ways to go. And it's super fun because at that meeting, there are, lectures on, the future of healthcare, what's coming down the pikes from CMS. And, on Tuesday is Hill Day, and all the state delegations go around and meet with their state, legislators. And it's a really fun meeting.
Yep, it is. I'll be there next week. We have another question. How can we make sure our existing recurring OrthoPAC donations are credited towards the MSTS numbers? Not sure. That may be a little bit of a logistical question. I think that probably the key thing is we do a better job as a society making sure you guys are in tune, all our members are in tune as to when that donation period and match period occurs. And we're getting better communication to our members. It sounds like Carrie's also going to answer here, but I think it seems to be the best way to communicate that. I think you can also delegate it when you actually submit it to say, is there a way to get that donated over? That may be more related to OREF than it is to AOS though.
Yeah, I mean, the Office of Government Relations can certainly keep track of, which of our members are donating to OrthoPAC. And then during that match period, that's when it goes. It's only during that time of the year that it goes to another organization. And I'm sure maybe even Sarcoma Strong would qualify for that. You just have to pick out an organization. And if it's not on their approved list, you just have to ask.
Okay. Well, that's all we have from a question standpoint. I want to thank both of you and thank the task force for everything. This is our first webinar on advocacy. We look forward to having another one in the future. Again, this will be online. And I look forward to people submitting their cases of patients or things that didn't go right, where, your prior authorization wasn't cleared or you had to delay a surgery or something like that. Get your stories from patients, send it in to us. We're looking forward to putting those up. And with that, thank you, everybody, and good night.
Awesome. Thank you.
Good night. Thank you.